entire day dedicated to raising awareness about AIDS. It is a devastating disease, but there have been a number of medical advancements yielding some positive results. Dr. Kees Van Dam and Dr. Cynthia Snyder are infectious disease specialists at Cone Health, and they're here to talk about it. Good morning to both of you.
Good morning, Brad.
So this is something that has changed, at least our outlook and the way that we view AIDS, and obviously there have been some advancements. Tell me about what's different as opposed to, say, 10, maybe 15 years ago.
So the most recent developments, at least what we're trying to improve upon, is the adoption of what's called PrEP, which is pre-exposure prophylaxis. It's a tablet you can take once a day, and if you take it daily, you can prevent getting HIV for greater than 90%.
Really?
Yeah, and the thing is, we've actually known about this for quite a few years, and the challenge is getting that message out to the community. And in the last year...
Now, this is something that is already on the market.
It is.
Yeah.
And for several years, actually. And so about 52% of the new cases of HIV have been diagnosed in the Southeast. But when you look at the data of who's been receiving PrEP, only 30% of those receiving PrEP reside in the Southeast. So this is discordance. So much more information and education to providers as well as consumers and patients to know about taking PrEP to prevent HIV.
Now, she was talking about the need for greater awareness and the need to reach people about this and other advances. Is there kind of a block in communication? People say, I've heard about it, I know about it, but things have changed. And as she said, that this is one thing that can be a game changer.
Yes, I mean, I think what you're getting at is there's not enough education and penetration of this information to the general public. You know, treating HIV is a lot easier than it used to be. People could take one pill once a day, do fine, and live a healthy life. But it's getting tested and getting on treatment, and it's trying to prevent getting HIV with PrEP, or pre-exposure prophylaxis. It's such a potent tool, but a lot of folks in the community, a lot of physicians don't know about it. And we've actually been trying to get out there and educate primary care docs because they should be prescribing pre-exposure prophylaxis.
And I'm on the outside of this, but what would be the downside to this? Is it an expensive medication or something? It seems to me like it would be common sense.
So exactly, I think you touched on the key aspects.
Right.
We know that health insurance in the community is very challenging to get. It's very expensive. You know, a lot of people are underinsured or uninsured. Luckily, there are programs to getting access to this medication for free. Even at our clinic, at the RCID, we have actually a grant to put about 40 patients onto PrEP, and there are also other clinics in the community that provide it for free as well.
You touched on something though. You talked about living with HIV, that it is something that is, I don't want to say taken for granted, but we're seeing people just basically with the right medication, in the right situation, just live for many, many years, and it's really not impacting their life like it did in the very beginning.
No, not at all. People can live very, very healthy, productive lives. I mean, there's still things we need to fight, like stigma. There's still a lot of stigma around the diagnosis. You know, I mean, someone could have diabetes and take one pill once a day, and they wouldn't have the kind of stigma that they do with HIV. So that's something we still fight. But yeah, you're right. They live very productive lives. But I guess one of the things we're trying to kind of hammer home is this idea of also preventing HIV, because with PrEP, you take one pill once a day while you're at risk for HIV, but presumably you're not going to be at risk your entire life. But right now, if you get HIV, you've got to commit to a lifetime of treatment and taking meds every day. So that's why we think PrEP is going to be such a powerful tool to help folks avoid getting HIV, and that's really a great pathway to helping us end this epidemic.
Well, as you said, it's not only reaching the patient, it's reaching providers, and reaching insurance companies too, reaching all components of the equation there and letting them know about the differences. Thank you so much. We appreciate your time this morning. And it is certainly a more positive message than we would have had just a few years ago, that there is hope out there. If you need more information on how Cone Health can help care for people infected with HIV, visit conehealth.com/RCID, conehealth-rcid.com/PrEP. You'll find out more information there.
House Call on Fox 8 is sponsored by Cone Health.